Welcome to another edition of Nurse Minute. I'm Brenda Marks with Surface Medical. I'm here this morning with Carl Runge, who's the president of Equip Systems in New York City. Good morning, Carl.
Good morning, Brenda.
Carl, I'm wondering if you could tell us a little bit about yourself and Equip Systems.
Absolutely. So, Brenda, I've been working with Equip Systems over the last 6 years. Equip Systems was founded in 2004 and set out with the goal of helping facilities manage their equipment. Managing their equipment from a periodic deep cleaning and disinfection perspective, but also from a surface management perspective to make sure that each piece of equipment that they have in their facility, one, is ready to be put into circulation from a patient care perspective, and two, is in condition to be disinfected on a day-to-day basis.
So, Carl, with all that equipment you're looking at, how often do you encounter damaged surfaces, and especially soft surfaces, such as mattresses, pads, etc.?
We have seen soft surface equipment be soft surface tears and soft surface damage across facilities throughout the country. It seems to be a problem at all locations that we work in. Now, whether it's on a few items or on multiple items, that really does vary based on the condition and the use of the equipment, but it's something we see across the board.
And in your experience, what types of damage are you most commonly finding?
The soft surface damages that we most often come across are tears. Tears in mattress pads, whether they're from the operating room tables, from stretcher pads, but then also in areas like stools, on wheelchair chairs, really anything that can be torn. Hospital equipment goes through so much use that tears in the equipment, soft surfaces, is something that you see on all types of soft surfaces in the hospital.
Here's a question for you. How do you see your clients dealing with this issue?
When Equip Systems is brought in, we're brought in to do a survey of all of the equipment at the facility in many cases, but then also to make recommendations and flag equipment that needs further attention that our team cannot address. So what we often see with equipment that we've identified that requires further attention is that the facility will, one, either take that piece of equipment out of circulation and replace it. Two, they will address the damage with their internal effort. Or three, they will let the issue go unaddressed and put the item back into circulation.
And would you say there are any risks associated with that third option?
I think there are risks with all three. I mean, one from a capital expenditure perspective, particularly as you start to look at some of these very expensive OR mattress pads. With the second option, really what is often being done to repair the surface is not something that I would recommend, whether it's tape from a unit being put over a mattress pad hole or adhesive being used that may not seal the surface well enough. And then with the third, obviously putting the item back into circulation without addressing the issue clearly does not meet the need the facility has for making sure the equipment can be disinfected on a day-to-day basis.
Okay, that's a good point. So if it's not totally intact, it's not possible to clean it properly. Is that correct?
Exactly. So for our team, if we come across an item that needs that type of repair, our recommendation is that repair needs to be done. One, either professionally, or two, the item needs to be replaced, because sending it back into circulation with a repair that isn't 100% regulatory compliant can lead them to some issues in the future.
So I guess, are your clients worried about damaged surfaces when they're preparing for a survey?
Absolutely. When looking at survey preparation, whether it's Joint Commission, DMV, Department of Health, these groups are focused in on helping the facility ensure that they are managing their equipment, but also managing the entire facility up to the standards that are set by their organizations. One of those standards is to make sure that soft surfaces and surfaces that are disinfected on a day-to-day basis have that integrity where they can actually be disinfected. So our clients are absolutely focused in on making sure that they have a program in place to look at that equipment. That is the case. What we are seeing, though, is that the focus on surface management has gone from a regulatory agency standpoint to a day-to-day standpoint where everyone understands, in the quality care environment, having a piece of equipment that is damaged in sanitation can not only impact infection control efforts, it can impact your HCAP scores. So I see the focus shifting to a really ongoing effort to address the problem.
Well, that's good news.
It is.
I'm glad to hear that, Carl. So I guess, Carl, do you have any last comments for us? Any stories that you may have come across over these years with damaged surfaces?
The stories that our operations team we could talk about for days. I would just draw the attention to the need for a focus, the effort for who is responsible for the soft surfaces at the facility. What we like to say is the equipment that we manage is used by everyone but by no one. So having a process in place for who is addressing these tears and who is addressing the soft surfaces and the integrity of the soft surfaces be the first step into implementing a program for how do you manage those surfaces going forward.
That is a very good point, Carl. We see that here all the time as well. So I'm hoping that's something, it's everybody's responsibility, I guess.
It is.
That's the point. Yeah. Well, I want to thank you so much, Carl, for joining us this morning, and I look forward to speaking with you again very soon.
Thank you for having me.